Coming up on Why Should I Trust You? Few things get more anger boiling in America today than dealing with healthcare. Anger over having your claims denied over and over, losing your mind navigating a maze of insurance bureaucracy, fear of putting off critical exams because of astronomical out-of-pocket costs. We saw it spill out into the open in an extraordinary way in the vicious reaction to the murder of the United Healthcare CEO. Now, Attorney General Pam Bondi says she is receiving death threats after calling for the death penalty for Luigi Mangione, the accused murderer turned folk hero. Today, we're going to speak with former health industry whistleblower Wendell Potter, who one day looked in the mirror and he couldn't live with the person he saw staring back. Now he dedicates his life to upending his old industry. In our deeply divisive conversation about health today, is the dire need to fix healthcare the one thing we can all agree on? Let's get started. Welcome.
Welcome
Back to the podcast. Who are we? I am Brenda Adhikari.
I am Tom Johnson.
I'm Maggie Bartlett.
I'm Mark Abdamalik.
That still sounds like the 60 Minutes thing.
I love that.
Tom, I feel like we need to remind people of what our podcast is.
That's a good idea. So some of you clicked on purpose, some probably by mistake, but this is a podcast about how America's trust in public health and science and medicine, all of it is plummeted. What do we do about it? How do we get that trust back?
So look, healthcare clearly is a massive subject. This is a topic that I think it's pretty safe to say unites our country, and not necessarily for good reasons. You know, we are angry about healthcare. We are angry about our health coverage. I am not happy with my healthcare and my health coverage. And it's something that we really feel like is driving a lot of mistrust for the system right now.
That is for sure.
I think we need to, before we get into the meat of it, I think we need to make sure that you guys are qualified here.
We are not.
I'm going to give you guys, you need a test. I'm going to give you guys a quiz. I want to see what you guys know.
Oh, no.
Here it's a multiple choice quiz. It's pretty easy, but here are your answer options: copay, deductible, premium, subsidy, co-insurance. At the outset, do you guys know what all those things are?
Can I call my wife?
Okay, wait. Hold on. I know what a deductible is, okay? A deductible is the amount you pay before your insurance kicks in.
That is right.
As in, I have a high deductible. Right. Yeah.
All right. So
as in, I have a shitty high deductible.
Right.
Okay.
To use it in a sentence, I have a high deductible.
All right. Copay. What's a copay?
I know that.
Go for it.
Okay. Are you going to make a new visit? Here's your copay. You got to pay it. It's going to be X amount of dollars. Thanks for seeing us today. Or picking up your medicine. The copay is it's like a set amount of money for the thing.
Good. You got it. Okay. Who decides the copay?
Oof.
I'm going to say the insurance companies.
So you got that's half right. It's your insurance company, and it's like a combo deal between your insurance company and maybe your employer. And they decided this is the package they want to give you, and they want to make sure you have skin in the game. So they make sure that you pay every single time you go, so that you wouldn't just go for silly things.
Got it.
All right, co-insurance. This one's a little bit tricky.
You made that up. There's no such thing.
True.
Wait, really?
True.
Oh my God! I've never heard of
true.
co-insurance.
All right. Anybody know?
I don't think so. Give us a hint.
All right. It's sort of related to your deductible, but it's like a hit after you've met your deductible.
Oh, I know what this is. This is like 80-20.
It's 80-20.
The insurance company pays 80% of the thing. You're going to pay 20% of the thing.
Oh, right.
Even after you met your deductible.
Yeah,
so it's we're always in this together. Every time you go, I'm going to pay 80%. I'm an insurance company. You're going to pay 20%. Co-insurance. Okay. So then there's subsidy. That one is just, if you need some financial help, the government's going to help you out.
This is Obamacare.
It starts, it's around Obamacare, and there's certain, we'll probably get into that a little bit. Yeah. But you guys, you know what? I'm going to give you guys get an A minus. That was pretty good. No, A minus. Good job.
Wow.
Wow.
All right.
Great inflation.
Thanks, Mark. My head hurts already, but that was a good exercise. But let's set the table before we dive into our main course. And we are so glad to welcome Wendell Potter as our guest. Hello, Wendell.
Hello, Brenda. How you doing? Hey, guys.
Hey.
Really good to see you again, Wendell. Wendell is a former vice president for corporate communications at Cigna and is now the president of the Center for Health and Democracy. He also writes the newsletter Healthcare Uncovered. and he's been firing off one op-ed after another. Wendell, it's so good to see you. And Wendell was actually a guest on the show I used to work on called The Problem with Jon Stewart. We loved having Manazik on as a guest. So Wendell, we're going to bring you into the conversation in just a minute. But first, we want to, like we said, set the table before we dive into this topic with Wendell. So Tom, help us understand where we're at.
Yeah. It's as we sort of stated, it's a massive topic. So, we'll just take a slice at it. There's a brand new poll that captures some of that angst and anger that you were talking about at the top, Brenda. 6 in 10 Americans right now say they are worried about the cost of healthcare and of getting landed with an unexpected medical bill. So that's 60% of us just kind of live with this low grade or high grade fear of what could happen if we get hit with a bill. This is a range of costs that people are worried about. This could be your prescriptions. It could be an emergency. But overall, paying your medical bills ranks the highest on people's sort of economic worry meter. It's even above paying for their home. And certainly above kind of the day-to-day expenses. So it's really something that hangs over America in a really bad way. And, there is obviously a population in America that struggles to pay bills each month. And, of course, medical expenses and the unexpected, that number moves up to 8 in 10 who live with that worry. So 80% of folks that struggle to pay a monthly bill are really laser focused on, the fear over medical bills just destroying them.
I mean, basically, at the heart of the problem here is that we as a nation, as a people, we cannot afford the health care that we need. We want to be healthy. We want to get rid of chronic disease. We want to, live a long, healthy life, but we just can't afford it. So another survey found that more than 1 in 10 Americans say they could not afford care and medication in the past 3 months. And that's the highest level that's been in years. I mean, we're hearing the news of financial strain in the markets and anxiety. And, that's not right now. 91 million Americans say if they had to have like medical care, they may not be able to pay for it.
Yeah, and the one in 10 over the last 3 months is that's not like how you feel about things or what you're scared about. That's like I literally couldn't pay for something.
Yeah. And then there's the people that can afford it and they do, but it really hits hard. I mean, we just went through like the quick things. I mean, everybody knows the copay. I mean, I see patients all the time. I hear them checking in. I hear what their copays are, sometimes $30, $40, $50. But when I hear that they've paid $100 copay, it really gives me pause because I think that is a barrier for people to sometimes go to the doctor. If you have to shell out $100 every single time, again, on top of the premium that you already paid, which again, the premium is like your subscription fee for like Netflix. You pay it just so you could access your health insurance. But, the Commonwealth Fund, a nonpartisan group, summed it up. I mean, they basically said, despite more people having healthcare coverage than ever before, our research found that nearly a quarter of working age adults had insurance, but were underinsured. That is enrolled in health plans with a high out-of-pocket cost that makes it difficult for them to get care. And we see people like, okay, look, I'm just not going to go to the doctor. I mean, I don't know. Has anybody here, like you just say, I'm
100%. Yeah. I mean, I think I'm part of this underinsured group where, and look, a lot of this, I think for me also stems into this, unless you are employed in a company that pays for your health insurance, you are getting ACA coverage, you are getting Obamacare coverage. And in my case, my show ended. I was working at a big company. That show ended. I lost the health insurance that afforded me. I got onto the marketplace. The coverage just isn't as good as what I had before. And so what it's resulted in is me skipping appointments. But the truth is, for me to have to rebuild my health plan, like none of my doctors take the insurance anymore. Yeah. I have to start from scratch to kind of find people. And again, don't feel too sorry for me. I'm fine. I'll figure it out. But I think it's like if even somebody like me who I'm fine, I can afford health coverage, but I'm really struggling to even piece back a health plan that works for me. Imagine Americans out there who are struggling to pay their bills and struggling to come up with some way of protecting their families.
Yeah, Maggie, you looked at like how much this costs like families. What is the number?
Yeah, it's pretty wild, Mark. It's the average health insurance premium paid by families was over $25,000 a year, up from 6% just from the previous year. And, We mentioned the December murder of the United Healthcare CEO, Brian Thompson, and the reaction that unleashed. Of course, this was an unspeakable act, but the anger that spilled out online was really, really something. People were just pissed at this inequality and this feeling that your health only matters if you're rich enough to afford the best insurance. But there was also this feeling of being really powerless when dealing with these insurance giants that so impact your health and not really having an avenue or a solution to move forward.
Yeah. I mean, Maggie, you said that it's $25,000 a year.
Yeah.
Okay. I'll never forget a story that I did about members of Congress and what they have to pay. And why can't we have what they have in terms of their health insurance?
What do they pay?
I want you guys to guess. How much do you think that a member of Congress has to pay just to get access to, regular health insurance, while they're in Washington to take care of emergencies and everyday stuff? How much would you say?
Like a monthly premium or just for the year?
Or a year. So Maggie said $25,000 a year. What about a member of Congress?
I want to say $5,000 a year.
Lower.
Stop.
Lower?
What is it? Oh my God, what is it?
$650.
No.
Okay.
Are you
This is if
fucking
they
kidding
want.
me?
I'm not kidding you. This is what if they want, they can pay $650 a year.
They have the option
$50 a month. They have the option to do it. It's extra. It's in addition to their regular health insurance, and this gives them basically access to like a full spectrum of services. It's an office of the attending physician. It's there for them to just have at their beck and call.
Wendell, what do you think about that? The people that sort of set the policy from a federal level are enjoying wonderfully inexpensive go-to insurance.
Yeah, I think that's one reason why the system is continuing the way it is, because they're insulated from what the rest of us are experiencing. It doesn't surprise me. It's appalling. But insurance companies know how to influence those guys. Not only do they have that kind of a sweet deal, but these companies spend enormous amounts of money on campaign contributions and lobbying expenses. It's just incredible. I'm down there a lot. I see it, and I think you referenced the reaction to Brian Thompson's murder, and I think people are beginning to realize that they might have a voice. They might have, their voice might matter if they can figure out how to organize it, or if there can be some organization of this anger. But it is outrageous. It's absurd. And that $25,000, by the way, is just the premium. That doesn't include those out-of-pocket expenses that you all were doing your little quiz about. You could be on the hook for up to $18,400 as a family in out-of-pocket expenses, even with insurance. So, and that's what's referred to as underinsurance.
Yeah.
But another term that I've heard lately and I use is functionally uninsured. You have a health insurance card in your wallet, but you often don't take it out because your out-of-pocket expense, your copay, your co-insurance, your deductible is going to be so high that you don't know how much it's going to be. First of all, you never can find out in advance how much something is likely going to cost you, so people don't go. It's insane. People in this country kind of grew up with this system, and it is the way it is because the health insurance companies and big healthcare providers are doing quite well with the current system. It's the rest of us who are not doing so well. We have a growing problem in this country that we often talk about of wealth inequality, but we increasingly are having a problem of health inequality, in which only the wealthiest among us are going to the doctor or getting the medications whenever they need to. People are walking away from their pharmacy counter these days when they have insurance, but they're told how much it's going to cost them to take that medication home with them.
Yeah, and you talk about health inequality. That was the dream of Obamacare, which actually did, move us into a better place when it comes to insuring Americans. Mark, you crunched the numbers of pre-Obamacare and where we are now.
Yeah, to Brenda's point about where she got her health insurance, it's possible because of the Affordable Care Act or Obamacare. And we had a huge problem where there were just lots and millions of people who are uninsured. And the number of uninsured Americans has been cut in half because of Obamacare. So right now it's like 1 in 6 before the law was passed that were uninsured, but now it's 1 in 13. So it's obviously more than about the numbers of uninsured because there's the cost issue, but the Affordable Care Act also changed the narrative about what you could even call insurance. So they basically cracked down on harmful practices like insurance companies refusing to cover you for a pre-existing condition. So you had breast cancer, oh, sorry, you're out, or flat out not covering things as, even like the mammogram. Now you have to have certain bare limits before you can even call yourself an insurance plan. But like we talked about, the cost is being shifted more and more towards the patient so that everybody has skin in the game so they don't overuse services, and I think that these high deductibles are keeping people, like we said, from going to the doctor. So again, what's the point if you have insurance? 1 in 4 Americans has skipped going to the doctor because of cost.
Right.
Yeah. Yeah. And so it's like Obamacare is like popular, but at the same time, people feel undercovered, underinsured, paying way too much out of pocket. Trump in the first iteration, Trump 1.0, he tried every which way he could to dismantle Obamacare. Republicans, took some hits at the ballot boxes over doing that. Americans said, like, we don't want to go back to pre-Obamacare. Now there's a lot of questions about, things like paying for extending the Trump tax cuts, and Congress is looking to recoup money. And there's a huge target on Medicaid because, of course, part of Obamacare was expanding Medicaid out in the states, providing money for states to expand the numbers of people that could get health insurance through Medicaid. These are people working at or near the poverty level. And there's, like a big fat target on Medicaid right now. And could that be the place where, billions of dollars is cut? So things are lining up in a way in which, at least from the federal level, we may not be moving in a direction where people are going to be happier with their healthcare coverage. In fact, just the opposite. It may be a place where, money is saved and an insurance is cut on a lot of people.
Right.
So Brenda, a lot to chew
I know. This is a lot to digest. In fact, let's take a minute to digest it. And when we come back, the man who's been called America's top healthcare whistleblower, Wendell Potter, is going to join us. Okay, welcome back. And we are so glad to have Wendell Potter as our guest. Wendell, as we said, is a former vice president for corporate communications at Cigna, and is now the president of the Center for Health and Democracy. Wendell, welcome.
Yay.
Thank you, Brenda. Good to be on the show. And good to see you again, by the way.
I know, it's so good to see you. So look, first, just tell us a little bit about your story. What makes you America's top healthcare whistleblower? What happened?
Well, I worked for the industry, the health insurance industry, for two of the biggest companies in the business, Humana and Cigna, for 2 decades. And I rose up the ranks to jobs of quite a lot of responsibility and visibility. And I mention that in particular because I was vice president of corporate communications at Cigna when I decided to leave the industry. And that job gave me an understanding of how these companies make money, where the money comes from, what motivates their decisions. When I say there, I'm talking about the people who are in the C-suite, just a small number of people who they answer to, what matters to them, and what that means for the rest of us. And I saw that because these companies are New York Stock Exchange traded companies, they're beholden first and foremost to Wall Street investors, to shareholders, and a small number of Wall Street financial analysts. It's kind of it's worth noting that Brian Thompson was in New York for United Health Group's Investor Day, in which he and other executives would be talking to, again, the people who are most important to them, the stakeholders that are most important, and those are the shareholders. When I learned that, and then I saw how downstream in the company decisions are made and what the expectations are that have led to people having insurance but not being able to use it, as you were talking about before. being saddled with high deductibles, being subjected to prior authorization, which I'm sure we'll touch on in a minute, the various barriers, and you mentioned too, your doctors and hospitals not necessarily being in your network. All these are barriers that insurance companies have set up over the years that make it increasingly difficult for you to get the care that you need, even if you are paying 25 grand a year for your health insurance. That's why I left, because I saw the incredible unfairness of this. And then I saw, we can talk if you want to about some of the things that I saw up close of people who were in a predicament, in many cases having insurance, but resorting to get care in barns and animal stalls in this country.
Well, that's what I want to ask you about, because I was really struck by that story you told in that article, and you've said it before. Tell us about what happened when you went to that. Was it a fair in Tennessee? Tell us what you saw there.
Well, I grew up in northeastern Tennessee, which is the Appalachian part of the state. And I went to visit family and read in my hometown newspaper about a healthcare expedition that was being held at a nearby county fairground. And I was very intrigued by this. I never heard of such a thing. What it was a big pop-up clinic that was being held over 3 days. And I went there out of curiosity. And when I walked through the gates of that fairground, I saw something I just never could have expected to have seen in this country. People were lined up by the hundreds in many different lines. And I noticed that in some cases, those lines were leading to barns and animal stalls. This was a county fairground where just a few weeks earlier, there were prize pigs and horses and cows and chickens. And volunteers had cleaned up the animal stalls as much as they could, but doctors were volunteering their time examining patients in animal stalls. And it just hit me like a ton of bricks. I realized immediately that I had to take some responsibility for that, because in my job at Cigna and before that at Humana, I was responsible for enhancing the reputation of my companies and getting people to believe things that just simply was not true. And I also realized that I was doing the exact opposite of what I used to do in my first career. I was a journalist. I was a newspaper reporter in Tennessee and later in Washington. And I was just horrified to come to realize that what I was doing was I was being paid to mislead people, not to give them the facts and not to mislead them, but to purposely get people to believe things that were not true. I mean, that was a crisis of conscience, and I made a decision I had to find some other way to earn a living.
Yeah. And so, I mean, I know we've spoken before, and we want to get into a lot of the things that you have seen on the inside, but given everything you have seen on the inside, right now, do you personally trust the health insurance industry? And I guess more importantly, should the rest of us, should we?
I trust the industry less than when I was there, because these companies have become massively bigger and even more beholden to shareholders than ever before. The industry has consolidated even more. That's why United Health Group and Cigna and these other companies and Aetna, which is now owned by CVS, they've become massively bigger than they were when the Affordable Care Act was passed and when I was in the industry. And they're even more beholden to the whims of investors. So I think there's more reason for us to be concerned about these companies and the way that they treat us than ever before. Since I left the industry, Brenda referenced my newsletter, Healthcare Uncovered. I write about their earnings and about what's important to them and how the things that they do to make sure that they're not missing Wall Street's profit expectations.
Wendell, I think a lot of people are listening now and they're thinking, here's a guy who was part of the machine. He sold the image of an insurance company to the public. He sold it to shareholders. He was part of this profits over people approach. Why should people trust your diagnosis of the problem? Why should people trust your solutions?
And I appreciate that. There's some people who just don't cut me any slack at all, because I did do exactly what you said. A friend of mine, also who I went to college with, soon after I became a whistleblower, asked me why I was biting the hand that fed me for so many years, and it's true to a certain extent. That's what I have been doing. But I do know how these companies operate in ways that very few people do because I was an insider. And I follow these companies very closely. Everything that they say and what they tell shareholders in particular, I follow this industry. And I have seen, as Mark was saying, the Affordable Care Act did a great deal of good. It outlawed some of their most egregious practices. But what I knew was that they would find some other ways of being able to meet Wall Street's profit expectations, and they have. And sadly, I think part of many of these companies have seen that they needed to expand into healthcare delivery increasingly as a consequence of some of the provisions of the Affordable Care Act that were well intentioned. But now United Health Group, for example, is the biggest employer of doctors in the country. It owns many clinics, hundreds of clinics around the country. All these companies we were talking about. Pharmaceuticals, they within these big middlemen, and that's what they are. These are middlemen in our healthcare system. They now own another big middleman, which is called the pharmacy benefit manager, and an insurance company and its PBM determine how much your drugs are going to cost and how much you'll have to pay at the pharmacy counter. So I know this industry pretty well from being a part of it and continuing to study it and their behavior and the consequences of their behaviors on so many Americans.
Yeah, Wendell, I mean, it is so complex, but I think it would be really helpful for if you could just tell us, what did you see on the inside that has given you so much pause? Like, are there examples? Like, tell us something that really can help us understand what you saw.
Well, among the things I mentioned, prior authorization, and I'll touch on that because that was ultimately the reason why I left. Even with that experience at that county fairground, I hadn't made a final decision to leave the industry until a few months later. One of the things that my team and I did was handle what we referred to as horror stories or high-profile stories in which someone was being denied something that the patient's doctor said he or she needed. And in many cases, the insurance company would overrule the treating physician and say we're not going to cover that because we don't think it's medically necessary. We being the insurance company.
But how common is that? Like, how common is that?
That's incredibly prevalent, increasingly so, to the point that the American Medical Association does surveys of its membership, and those surveys have shown that increasingly doctors are saying these decisions by insurance companies are putting their patients' health in jeopardy in many cases, and in many cases. These delays and denials that are caused by the use of prior authorization are lethal. People die, and that was the case. The story involved a 17-year-old girl in Los Angeles who needed a liver transplant. Initially, Cigna agreed to cover it, but on the day of the surgery, when a liver had been found that was the perfect match, a medical director 2,500 miles away in Pittsburgh said he didn't think it was medically appropriate for Natalie Sarkeesian. And so the surgery was canceled. The liver had to go to somebody else. And the family made a big stink about this, got a lot of media attention to the point that it became a huge PR problem for Cigna. I was on the hot seat, and I had to keep the C-suite informed of what was going on. And ultimately, the CEO made the decision, well, let's try to make this go away. Let's reverse that denial. And the company did. That can happen, certainly. When a CEO decides there's a PR problem, you can flip a switch and things will change. Unfortunately for Natalie, several days had gone by and she got sicker. And by the time that Cigna said it would approve the transplant, she was too sick and she died 5 hours later. And I just didn't have it in me to handle any more of these cases. But Mark, to your point, it happens routinely, and it's especially prevalent in so-called Medicare Advantage programs. The companies not only are selling insurance on the commercial market, but increasingly they're involved in public programs like Medicare and Medicaid. And it's especially prevalent in those programs. And that is one of the main ways that these companies are able to meet Wall Street's profit expectations. It's a lever that they can pull if they need to. when Wall Street's not happy, they can tighten up or make greater use of prior authorization. They can change the configuration of their provider networks. They can change the tiers that your drugs are on. We could go into various ways, but
Yeah.
these are the ways that the levers that they know that they can pull to meet Wall Street's profit expectations. But every one of them, they have a consequence on our ability to get the care that we need.
Wendell, what would these insurance companies say in response? Like, let's just for a second assume that they're acting in good faith, okay? What is the good faith response to this? Is it that America is getting sicker by the minute with all these chronic diseases, and so the actual cost of care is rising, and we're the only ones that are backstopping it other than the government insurance programs? Like, what is if we're just assuming for a second that these aren't evil people, what is a good faith argument for why it is the way it is?
Well, first of all, thank you for saying that because they are not evil people. I would argue that the system very well could be if we want to assign a name to the system. And also, very few people who work for these companies are in a position to see all the things that I was able to see because of the role that I had. Mark used the term earlier, skin in the game, and the insurance companies and employers several years ago, more than 20 years ago, decided that the managed care plans that we had been most of us forced into was no longer working for them. And back then, most of us were paying, if we went to the doctor, maybe a modest copayment of $10, for example, to go to the doctor, or $5 to get our medication. That was limiting their profits, and they decided, well, we've got to change that. So we'll make people pay more out of their own pockets before their coverage kicks in, much more than that copay was back then. That was one of the things that I had to do, was to try to sell that idea on Americans and on employers to get people to believe that it was in their best interest to make this kind of a change. And it certainly benefits those of us who are healthy throughout the year. But it's only when we get sick or injured that we find out that's not necessarily such a good thing for us as Americans. But skin in the game was a term that we used to try to sell that people were not adequately exposed to the real cost of healthcare goods and services. So that was one of the things that I used to do, and that they will still say that we need that in place to keep people from going to the doctor for silly things, as Mark said earlier. I don't think that necessarily is all that prevalent. I don't think there are many people who want to take chemotherapy drugs just for the heck of it. But
Yeah, nobody wants to go to the doctor.
right. But that we were wildly successful in selling America on the notion of moving us into high deductible plans. But they would also say that you need to have prior authorization in place because there are a lot of doctors who are treating people unnecessarily. They're prescribing more treatments. They have a self-interest in many cases. So the more procedures that's done, the more income the doctors or the physician groups get. There's some validity to that. I think there probably is a role for prior authorization to a certain extent. But we've got it to the point now that it is prior authorization is actually a profit center within some of these companies. Cigna has a big division that has a prior authorization shop and a service that it sells to other insurance companies. So they've learned how not only to use this to keep people from getting the care that a doctor says a patient needs, but how to make money on the whole operation of prior authorization.
Is it true that they use bots and they don't even read the prior authorizations and they just blanket deny them?
They deny that's the case, but yes, there have been investigative reports that have shown that they do indeed do that they've used an algorithm to deny hundreds and hundreds of requests at a single time. Now, Cigna in particular was accused of doing this, and which a medical director was accused of, or it wasn't accused. There was evidence that this medical director denied hundreds of requests in one fell swoop, without even opening the case files.
That tracks so much with, I think, everyone's lived experience of being like stuck in a phone maze
Mhm.
arguing for the fact they should be covered. This was covered last time. Suddenly it's not being covered, being disconnected, calling back, getting it denied, sending it in writing, getting in a phone maze. I mean, this is the way that Americans interact with health today. And we wonder what's driving down trust, you know,
That.
that.
Yeah.
Exactly. And those, we were talking about barriers. Those are real world barriers that people encounter every time when they're trying to resolve something like this. It's almost an impossibility. People give up, and it's intentionally difficult because, and people know that they get a denial, and they just think, well, it's useless for me to even give it a go because I'm probably not going to win. If they do appeal a denial, and usually they're successful. The problem is that these denials are happening every single day, and people are probably living shorter lives as a consequence. But if you do appeal it, then more often than not, it'll be overturned, which means that medically necessary care is being denied.
Yeah, that's so frustrating, Wendell. And I certainly have been in situations like that. And I think many Americans have. And that feeds into kind of the explosive reaction that we saw to the United Healthcare murder. Now that you've had a couple months to process that, what did that reaction kind of tell you?
It told me that this frustration has just been just right under the surface, and that people have been frustrated for a long time. I knew this actually when I first started working for Cigna. We were doing surveys of people enrolled in our health plans to find out what we could do to get them to like us better. And what we learned was that people wanted us to pay their bills and get out of their lives. But that's not a possibility for the way these companies operate, because their whole business model is to be so much involved in the decision making of the care that we get, that they can't change that. Wall Street won't let them. But that has led to enormous frustration, and people, I think, began to express that. Well, they did on social media platforms after Brian Thompson was murdered, in ways that I think took everyone by surprise. I was even a bit surprised, but then I realized I understood why. People are frustrated. They're so frustrated when they try to get an answer from an insurance company, even reach a live person on the phone. And once you do, more often than not, initially it's going to be someone in a foreign country, because these companies have offshored so many of their operations. That is another barrier. It's even more difficult than it used to be to get a real live person to help you walk through things.
Wendell, let me ask you. So when the murder happened, one response I think came from folks on the right were saying that, look, we are the world's richest country. We have the highest GDP per capita. Of course, we spend more on healthcare because we have more money. What is your response to that? Because I think that was one of the you're making a mountain out of a molehill about healthcare costs in this country.
We do spend more on healthcare than any other country on the planet. We spend close to 20% of GDP on healthcare, far more than any other country. We spend on average twice as much per person as other developed countries. And I'm talking about developed countries here, but our outcomes are not as good. So we're spending excessive amounts of money because of our Rube Goldberg type of system of health insurance, and it was never intended to be designed this way, but it has developed into this contraption that defies understanding, but also adds such complexity, and every part of that complex operation adds money. We spend about a third. I think this year we'll be spending over $5 trillion altogether in the U.S. on healthcare, and about 30% of that, in any given year, is administrative cost, consumed by administrative functions like prior authorization, and all that has to be put in place. And it's not just insurance companies, but because we have multiple insurance companies, and each company has a multitude of different kinds of health plans. That means a physician practice has to have people on staff who do nothing more day in and day out than deal with every one of these different permutations of private health insurance. And that adds to the cost as well, too. It's not just the prior authorization delays. It is having someone on staff at a physician practice or at a hospital. And big hospitals have literally their billing departments for some of their biggest operations.
Hmm.
That is not true in other countries, or any country for that matter. It is just an enormous waste that we have and that we tolerate because we feel like we don't have power to change it, but because it is the way it is. We grew up with this, and we just think this is normal.
Yeah. I was curious, like, sort of what the younger generation thinks about this. Like, you know, they maybe deal with insurance the least in terms of our, levels of our population. But I dug back and found a poll statistic that was very frightening. After the killing of the CEO, Americans under 30 are especially likely to think a mix of factors was to blame for the death.
Yeah.
And they say that insurance companies' denials and profits are about as responsible for Thompson's killer for his death. So, in other words, these denials and putting profit over people, these industry practices are about equal to the killer in terms of who is responsible for the or what is responsible for this death. I mean, that's a really, really frightening sort of perspective. What are your thoughts on that? Because it doesn't seem like we have a solution at hand, and a younger generation is just brewing in a way that is even more outstanding than older generations on this topic.
I read that and it was chilling. And even as you were talking about that, I felt chills because that I'm sure is an opinion that's held by a lot of people, that there was some justification in this because of how insurance companies treat people who are enrolled in their health plans. They refer to them as members, but this is not a club that many people would voluntarily want to be a part of. They find themselves in these health plans, and more often than not, most Americans, that decision is made by an employer because we get most of us who are not of Medicare eligibility age or too poor to we're not eligible for Medicaid. We get it through the workplace, and those decisions are made for us. We have felt kind of powerless as a result of all of this. And I think that is particularly true of young people. They're baffled by why we have this and see this. They know of people that are in their families who've experienced the inability to get something that they need or being able to afford it. So I'm
Yeah.
not surprised. The thing that I'm trying to figure out is, can that be channeled? Can that be that anger, that
Mm.
frustration be channeled in some constructive ways that can lead us to solutions to get us out of this mess?
Yeah, I think we want to talk about solutions. I mean, I think people do feel powerless. I mean, including physicians. I mean, everybody's talking about these incredible rises in healthcare costs. This is happening at the same time that physicians are trying to do more with less. Physician reimbursement has tanked. I mean, it has really dropped like 33% in the last 25 years. So every year there are cuts to how much physicians are being paid to do these services. At the same time, costs are going up, and it's really a head scratcher. It doesn't always like make a lot of sense. I mean, you also said in terms of this like trust and and there's an answer to Wall Street, and that's one component of why we're in this mess. But you also said it wasn't an accident, that Americans were almost deliberately steered away from trusting the government to provide health care so that insurers could step in and almost like they cultivated this distrust. Is that true? Like, what did you see to say to make you say that?
Well, I saw it because a part of my job not only was handling financial communications for Cigna. My name was on Cigna's earnings reports for 10 years. But I also worked with my peers in the industry and our trade associations to push back against any kind of policy proposals we didn't like. And certainly the ultimate was proposals that would lead to a a Medicare for all or single payer type of healthcare system, similar to what the Canadians have. They call their program in Canada Medicare as well, but it covers everybody. Um, we in the industry have long seen that as an existential threat. And I'm going to say we and my former self. And the industry spends an enormous amount of money to protect the status quo. And this goes back, though, years before I joined the industry, when after World War II, a lot of countries, certainly in Europe, looked to how they could build or rebuild their healthcare systems, and many of them have systems today that trace back to that era. We did not. We did not have any kind of coordinated plan. The insurance industry and physician groups, the American Medical Association, fought against efforts to have a more centralized national health program. So employers stepped in at that time after World War II. It was or during World War II, big companies began to offer health benefits as an extra incentive to get people to come work for them. And that just took hold. And that's why we have an employer-based healthcare system. It has become really, really entrenched and enormously profitable for insurance companies, whether they sell insurance or manage the benefits for employers. It has become enormously expensive. And to the point that these companies make billions and billions of dollars in profits every year, even as doctors, Mark, as you mentioned, are getting less pay. And they've been able to pull this off. As they've gotten bigger, these companies, they have more money to spend on campaign contributions and lobbying expenses. So we're kind of trapped in this for the moment. Although I'm in Washington about every week, meeting with members of Congress and staff, including physicians who are members of Congress, and they are beginning to wake up and realize that even the Republican members who've long been resistant to a lot of changes, and certainly were unified against the passage of the Affordable Care Act, they are now beginning to see that this system doesn't work for their constituents and doesn't work for physicians and even hospitals, because we're seeing hospitals closing around the country, particularly in rural areas and small towns, because big insurance companies are not reimbursing them adequately, and they're requiring enormous expense in dealing with them, as I mentioned earlier.
Wendell, we talk to a lot of people on this podcast who come at these issues with different perspectives. And, you mentioned that, America is paying the most for healthcare and still not getting a good outcome out of this. A lot of people we talk to say, you know what? That's the reason the HHS should be revamped, and there needs to be cuts and a reorientation of the mission of our health apparatus from the federal level. Others say there's way too much focus on infectious disease and not enough focus on chronic health. That's the reason why we're getting bad outcomes. You bring a really fresh perspective to us, which is like, hey guys, look at the system of insurance in this country. That's a huge driver of why we're not getting good outcomes, yet we're spending all this money. Just make that case, because so far that's a different part of the conversation. We haven't heard that yet from our guests, and I think you've got a real good line on that.
And I can assure you that my former colleagues are part of the effort to get people to believe that the problem is government bloat, is HHS having too many people on staff. That if we just take an axe to HHS and the Center for Medicare and Medicaid Services, we'll all be better off. It just does not work that way, because they're the cops that are potentially on the beat to keep us from being harmed by this industry, or at least robbed blind by this industry. And if we're not careful, we're going to take away even some of the supports or the help that is potentially there for us. But the industry is also very, very adept at pointing the finger of blame elsewhere. That's something that I used to do, and we see it all the time. And it is one of the reasons why so little seems to get done. That and lobbying and campaign contributions. But if you have big drug companies pointing the finger of blame at insurance companies, who are pointing the finger of blame back, if they're pointing the finger of blame at big hospital systems, which I have said, yes, we've had a lot of consolidation among hospitals, but I've often said that, in my view, that was in self-defense because so many insurance companies were consolidating. That's why we have just a handful of insurance companies that really call the shots. But we and my old job were really successful in getting people to believe things, as I said, that wasn't true, but to point the finger away from the health insurance industry. And we really haven't had a conversation about the role that health insurance companies play in our healthcare system in 15 years since the Affordable Care Act was being debated and ultimately passed. Healthcare is often referred to as the third rail in American politics because it is always so contentious and easy to mislead and politically fraught. After the ACA was passed, Democrats got a real whooping, as they say, where I come from.
Do you think, Wendell, that right now in the halls of our insurance companies that they are cheering the RFK and Doge cuts to HHS? Like you said, the regulators, the referees, the police of the industry are potentially being laid off or at least scuttled. You think they're happy about these cuts?
No, absolutely. I think they are because people who have been on their case or who are on their game are losing their jobs in many cases, or there are just fewer of them to do the job that's necessary. So I think they probably are. I would say, though, that I wouldn't necessarily think that the Trump administration is going to give the industry a pass at every turn. I think there's maybe some evidence that, like I said, Republicans are beginning to wake up to realize that the status quo is not good for doctors and hospitals in their districts and their constituents. So we'll see. But yes.
So the argument we hear from RK and Doge that HHS has to be cut because we're spending more and we're not getting the outcomes that we should be getting, and therefore we need to cut HHS is actually contributing to us spending more and not getting the outcomes that we should be getting.
It's an argument that I'm sure a lot of people buy. Another thing that's important to note here is that even with my job focus on healthcare, a big part of it broadly is to get people to distrust government. And that goes back many years as well, too. But the industry benefits when we distrust our government, when we think the government is too big, when we think there are too many regulations in place. That was something that I was a part of as well, too. It wasn't as overt as a lot of what I was doing, but the overall intent is to get people to believe that the problem is government. And again, that's pointing the finger of blame away from the industry to get people to believe it's not the insurance industry, it is the federal bureaucrats. The industry, and it's not just healthcare, but other industries have been a part of this for many decades now. And it is why at the top of the show we were talking about we Americans have just lost a lot of confidence in any institution in this country, whether we're talking about the media, whether we're talking about government, healthcare. We've lost trust, and it's largely because of this ongoing behind the scenes, almost invisible propaganda campaign that has been conducted with great success by corporate America. And I know because I was a part of it.
You know, Wendell, I wonder if another part of it is that what do we do with the reality that we as a country are sick? That we have such high rates of obesity, of heart disease, of diabetes, of hypertension, cancer, stroke, you name it, we've got it. 8 out of the 10 of the top killers in America are chronic diseases. And so this is a country that needs to go to the doctor a lot. This is the country that needs medical intervention or that needs its food industry or big ag or whatever to help support us to get better. I want to just pick up on something you said about, you're hearing more and more in the halls of Congress from, both parties on this issue. And I have this take, and I'm curious as what you think about it, which is like, I personally think right now, healthcare costs is like a jump ball for either party. Whoever takes on healthcare costs will win support by so many Americans for like generations to come. And I don't know that either party has fully taken it on. I think you're absolutely right that Obamacare was really the last time that anybody took on healthcare in a meaningful way. I don't really hear MAGA Republicans talking about healthcare costs all that much. I don't hear Robert F. Kennedy talking about healthcare costs that much. And I don't hear Democrats talking about healthcare costs that much. So I have this take that like it's there. It's a winnable issue for people because so many Americans are struggling with it. What do you think about that?
100% agree. And I think it would be a missed opportunity if Democrats don't figure this out, and Republicans as well, too. The Trump administration has put Congress on notice. One committee in particular, the Energy and Commerce Committee, which is referred to as a committee of jurisdiction, is under the gun to find $880 billion in cuts over the next 10 years. And the conventional wisdom is that they're going to find that with the Medicaid program. Republicans are realizing that may not be the easy place to cut because that means that doctors in their districts and hospitals in their districts are going to be disadvantaged, as well as their constituents. It's really difficult. But I think there really is opportunity if either party will begin to talk about this and look at the ways we are wasting money. I know it would resonate, but you have to also realize you're not doing this in a vacuum. You'll be doing this with my former industry mounting its incredible disinformation campaign. But it is. I think it's necessary if we're ever going to make any progress. And that's where I'm hoping that we might be able to channel some of the interest and the anger of young people. How can we really begin to develop the messaging and hold our politicians accountable, and to find the politicians who are willing to take this on and talk about it in a forthright way. I wouldn't be doing what I'm doing now if I didn't have hope and a sense of some optimism that at least our policymakers in Washington are beginning to pay more attention to the things they need to pay attention to. And both parties are. So that gives me some hope. I'm seeing for the first time ever bipartisan support on addressing some of the problems we've talked about ever. So that's encouraging to me.
Well, we are so happy that you joined us today, Wendell. I think that, this is a topic, like we said, so many of our listeners have brought up as something that really drives mistrust for them. It seems like not only is there a bipartisan agreement on the solution space, but I think there's something to be said about the fact that so many Americans from across the aisle are joined in their frustration on this issue. And I think there's a lot of value to the things that unite us, even if they make us mad. I want to thank Wendell Potter for joining us. He has a fantastic Substack called Health Uncovered. I really recommend everyone take a look at it if you particularly are interested in this issue. It's really great. That is our show for today. I'm Brenda Adhikari. He's Tom Johnson. She's Mackie Bartlett. He's Dr. Mark Abdul Malik. Please send us your questions, comments, stories about your own experience with healthcare at questions@whyshoulditrustyou.net. And we'll see you right back here next week.